Imagine you sitting down to read, and when you look at the words, they're spaced wrong, they look to be spelled the way they sound, and some of the words might be pushed together tightly as well. Imagine every time you sit down to read, you struggle with processing the words or numbers on the page. People who suffer from dyslexia deal with that on a daily basis. The National Center for Learning Disabilities has estimated that 17% of the population has been diagnosed with dyslexia. Unless you or a family member has dyslexia, it may be difficult to grasp what exactly dyslexia is. Over the course of this presentation, I will cover what dyslexia is, the causes and symptoms of dyslexia, and how dyslexia is treated. Dyslexia is defined as a learning disability marked by an impairment of the ability to read. While most people think dyslexia is a condition that involves reading from right to left and reversing words and letters, the brains of people with dyslexia are wired differently, making it difficult for them to break the letters or words into sounds. Specifically, dyslexia is a name for a specific learning disability in reading. It's often characterized by difficulties with accurate word recognition, decoding, and spelling. It may cause problems with reading comprehension and slow down vocabulary growth. Dyslexia may result in poor reading fluency and reading out loud. Dyslexia is not a result of poor instruction, though. With proper support, almost all people with dyslexia can become good readers and writers. Specialist doctors and researchers are not sure what causes a person to develop dyslexia. Some evidence points to a possibility that a condition is inherited because dyslexia often runs in families. Dyslexia can result from a brain injury, or it was found in a study by Dr. Sally Shaywitz in 1996 that a coherent model of dyslexia has emerged that is based on phonological processing. The phonological model is consistent with both the clinical symptoms of dyslexia and with what neuroscientists know about the brain, organization, and function. Each age group has specific symptoms that arise as the individual matures. In young children, they may be a late talker, have pronunciation problems, difficulty rhyming words, an impaired ability to learn basics such as the alphabet, colors, and numbers. They may have problems with handwriting and other fine motor skills, confusing letters such as B and D, or the orders of letters within words. Some may have trouble learning the connection between the letters and their sounds. Older children may develop poor handwriting and trouble following a sequence. Dyslexia can cause many other disorders such as anxiety and depression and give one low self-esteem. There are many treatments for dyslexia, some of which may involve time spent with speech and language therapists as well as tutors. Specific interventions involving the classroom, teachers, including special methods that have been created to treat dyslexia. In an article by Dr. Walter Dunson, a special education specialist, he recommends the Orton-Gillingham program and the Wilson system, two programs that were created to address and help students with dyslexia. In conclusion, dyslexia affects almost 17% of Americans today, and those numbers seem to be growing. With the struggles that are faced daily by those that are affected, early diagnosis and early intervention are key to helping them lead a normal life. Henry Winkler, Alexander Graham Bell, Leonardo da Vinci, Nolan Ryan, and even George Washington all live with dyslexia. Their success is a testament to the ability to overcome and live a successful life with dyslexia.